Hello, I'm David Parsons, and this video is about our article Current Perspectives on Augmented Reality in Medical Education, which I co-authored with Kathryn MacCallum. It's a systematic literature review. We looked at PubMed, Web of Science and Discover databases to identify articles from 2015 to 2020 that showed empirical research findings related to learning outcomes from the use of augmented reality. Our population were medical students, and we identified 21 peer-reviewed journal articles. Of course, we're looking at augmented reality in this study. That is, systems where the digital content is overlaid on the real world, as opposed to virtual reality, where the real world is not visible. We chose to examine our studies through a lens of affordances, because these are very helpful for examining user goals. They're generalizable and they provide a good means of comparison for evaluating augmented reality against physical reality. We identified 5 affordances from the literature, and we detail these 5 affordances in the article, and we use these to evaluate the 21 studies that we identified. This is our Prisma flowchart. We didn't follow Prisma exactly. Indeed, many researchers have adapted Prisma to suit their particular type of study. We didn't have a separate quantitative and qualitative analysis because our studies were focused on analysing through a lens of affordance. The years of publication show that more than half of our articles were published in the last 2 years, which we think is an important indication of popularity of this field. And the medical specialties covered were primarily anatomy and surgery, and this accords with much of the previous literature. It's also noted previously that visualization is common, but we also saw some other areas of specialty being examined: telementoring, nursing and paramedicine. Our findings were that this area of work is highly current and of increasing interest to the medical profession. There's a broad range of augmented reality tools being used, from low-cost tablets to complex simulators. Looking at the specialties covered, we do suggest that future research could perhaps go beyond this focus on anatomy and surgery to explore some more areas of medical education. And in terms of our view of affordances, we did note that those studies that did not address any of those key affordances showed relatively poor learning outcomes, whereas studies that did leverage affordances revealed positive outcomes. And we think this is an important contribution of this study. Thank you.